think one of the difficult parts for breast cancer patients is the aftermath. And sometimes we're sort of thrust into this, well, I'm so used to seeing my doctor almost every week. All of a sudden, I'm not seeing them at all. I'll see you in 3 months. And, what do I need to do to keep myself healthy? What can I do to make breast cancer not come back? And it's very difficult because there's some things we can do, and then there's many things we cannot do. And a lot of that has everything to do with what your risk factors were before you were diagnosed. So a lot of those risk factors are still going to be present. However, I think that we have quite a bit of emerging data that suggests that obesity, alcohol usage, these are things that are within our control, that they can make a difference and they can influence the recurrence rate in breast cancer. So when people are asking me, what can I do? You can do these things. Take good care of yourself. Make sure that you get enough exercise. Keep an ideal body weight, which is tricky for anybody in this country. And really be positive and have a good positive attitude, which I think makes all the difference. And the other thing is it is important to, if you're required to take medications as part of your treatment, you must take them, because that is what's going to give you the best statistical chance of not having a recurrence of your cancer. After someone has completed all of their treatment for breast cancer, they're not really done. And we know that a fair number of people can relapse. But not only that, there's sometimes some late effects that can be very tricky and difficult to manage. And we will recommend that you continue to follow up with your oncologist, usually for 5 years, sometimes longer, depending on your own circumstances, but to help with all of these problems, not just your risk of your cancer returning, but also to help you lead a good, healthy life and to take good care of yourself and to reinforce all of the things that we know are important, such as your weight or your habits or your lifestyle. It's important to keep those things in check as much as possible.